Welcome to page 25 of Anatomy Coloring Book. This is Dr. Stephen Harkins. The vertebral column. The vertebral column is divided into sections or regions. First, the cervical region. This is what's known as the neck, and we use the abbreviation C for cervical. And when we count the vertebrae, for example, C1, C2, C3, C4, C5, C6, C7, we're referring to cervical vertebra 1, cervical vertebra 2, etc. And each section of the spine has a curve in it as well of the vertebral column. Vertebral column is also known as the spine. And for example, in the cervical spine, there's a curve. It's a forward curve called a lordosis. In other words, the convexity is pointing forward. And that's called a lordosis. That's called, of course, the cervical lordosis because it's the forward bend, if you were, the forward curve in the cervical spine. The next region is the thoracic region. And it too has a curve, except this curve changes direction. No longer is it a forward curve, it's a backward curve. Of course, this is the posterior over here, this is the anterior over here. And this curve points backward toward the posterior. And therefore it is not a lordosis, but it is what is called a kyphosis. It's pushing backwards or towards the posterior, called a kyphosis. And of course, it's the thoracic kyphosis because in the thoracic region of the spine. And that's the region of the middle section of the spine. It's your middle back. We use the abbreviation T. We have T1 here, T2, T3, T4, T5, T6, T7, T8, T9, T10, T11, and T12. So it's a shortened way of saying thoracic vertebra number 1, thoracic vertebra number 2, etc., etc., etc. And you can say, let me outline that thoracic vertebra number 1 for you. This is thoracic vertebra number 1. And here you see the different parts of the thoracic vertebra, which we will go through in a moment. But here's this, you see the spinous process, the transverse process, the body. Moving on to the lumbar spine. This is what's known as the low back, the lumbar spine. The lumbar spine does not have a kyphosis. It is similar to the cervical spine in that it has a lordosis, called the lumbar lordosis, meaning that it has a curve that pushes forward or to the anterior, not the posterior. This is the back of the spine back here. Of course, these are the bumps you feel on the back of the spine called spinous processes. Here it is, spinous process. Each vertebra has a spinous process. Even the thoracics, even the cervical. Except for C1, vertebra number 1. You don't really call that a spinous process. It's not palpable. You can't feel it. But you can feel all the other bumps, the spinous processes on the back. Of course, we use the abbreviation L for the lumbar spine. So we have L1, L2, L3, L4, and L5. Lumbar vertebra 1, lumbar vertebra 2, etc., etc. Of course, you can see that there are 5 lumbar vertebrae. You can see that there are 12 thoracic vertebrae. And you can see that there are 7 cervical vertebrae. for a grand total of, you guessed it, 24 individual vertebrae. That is the lumbar region of the vertebral column. The next region is the sacral region. And the sacral region used to be divided up into, and this is the sacroiliac joint right here. The sacral region used to be divided up, and you can see me going over these bumps here, into 5 vertebrae during fetal development and child development. But these vertebrae, so they used to be sectioned off like this into 5 vertebrae. So it would be, 1, 2, 3, 4, 5, something like that. But these have since fused during development, and the sacrum acts as one unit. And so it is no longer different pieces, but we still kind of refer to it as though it has 5 segments. So you might call this area up here S1. You might call this area S2. You might call this area S3, this area S4, and this area S5. So it is one fused bone, but there are anomalies. Sometimes in a process called lumbarization, or a genetic anomaly, you might see on an X-ray a lumbarization of S1, where it in fact becomes separate from the sacrum, and there's a little disc joint in here, and the rest of the sacrum is one piece. That's called lumbarization. Or you might have the opposite occur. You might have the opposite occur where it's called sacralization, where L5 disappears. There are only 4 lumbar vertebrae, and L5 becomes a part of the sacrum, and you have one really large sacrum. That's called sacralization. Here it is, a sacralized lumbar vertebra. We call it a transitional vertebra. So L5 could become part of the sacrum, or S1 could become part of the lumbar spine. And these are just variants that occur rarely in the population, but you do see them occur. Maybe they're not so rare. They're fairly maybe common, but they're not the norm. Also, sometimes you'll see, you might see C1 or C2 on an X-ray fused to the skull, as part of the skull. And so just know that the spine is not always perfect. It does not look like this on every single person you see. And there are variants, what we call normal variants from the norm. Still normal, but not in the majority. That's the sacral region of the vertebral column. And lastly, we have the coccyx. It's this little bone down here. Call it CO. Actually, we often call the occiput CO as well. So the coccygeal region, and it has 4 segments to it, but the coccyx is known to be a vestigial structure. In other words, no longer used. The vestigial tail of an animal. If we were crawling or hanging from trees, we might have coccyx might be a tail, but that was sort of since we developed as humans, we no longer need that, so we just have this little vestigial coccyx bone. Now, what happens when the thoracic curve gets to be too much, too excessive? We call it a kyphosis. You've seen an old lady or an old man, for that matter, with a hump on their back. It's called a kyphosis. And you can see why, or you might call it a hyperkyphosis, is what you would call it. Hyperkyphosis. You can also have a lordosis, an excessive curve in the lumbar spine. We call that a hyperlordosis. And you could both of those occur in the sagittal plane, but you can see in the coronal plane here we have a scoliosis, the deviation in the coronal or frontal plane. It's the S curve you see on some individuals, and there's a test called Adams test. You can have this person bend over and touch their toes, and you'll see a hump. As you look from behind, you will see a bump as they go touch their toes. Let's see, this is them here. Let's see, bending down, touching their toes. You'll see a bump on the side of the convexity over here. The convexity of the lateral curve. And that's called Adams test. But the spine, the vertebral column, is not a rigid structure. It is not like a pole or a baseball bat. It is movable. And so each pair of vertebra is considered a motion segment. This is a motion segment with the vertebra above and the vertebra below. This happens to be L4 and L5 right here. And this motion segment has certain characteristics. Number one, the vertebra itself. This is the vertebra. This is actually the vertebral body you see here. Vertebral body of L5. And of course up here, the body of L4. And each bump and each ridge and each piece of connective tissue here has a name. So let's start with the intervertebral disc. Intervertebral, first of all, the vertebra is red. The intervertebral or intervertebral disc is as it sounds. Inter means between. Vertebra, vertebral, between the vertebra. So it's a disc. It kind of has these crossing fibers here, these tough outer annular fibers, they're called the annulus fibrosus. And deep inside the disc, you find what's called a nucleus pulposus. And here, let's draw here's the vertebral disc down here. And this is the tough fibrocartilage on the outside. And called the annulus fibrosus, like I said. And inside is something called the nucleus pulposus. It's a gelatinous type substance filled with water and protein sugars called proteoglycans. And they're showing an example of a disc herniation here, a problem that occurs in some people with back pain where the disc, it's like a jelly donut. The jelly from the donut, the nucleus pulposus, bursts through the annulus, the outer annulus fibrosus, and presses on the nerve that is exiting the spinal column right here, presses on this nerve right here, the spinal nerve. And here you can see free spinal nerve. And here you can see one that's being protruded upon. Obviously, that's going to cause pain, numbness, tingling, weakness. in the muscles and in the skin and the areas that this nerve innervates, L4 and L5. That would be the L4 nerve. So some other structures on the vertebra up top here is the facet joint. The facet joint is this structure that is protruded off the top of the vertebra of L5 here. It's this bump here, right here. Here's the one off the top of the L4 vertebra. It's called a facet joint. Now we can't see it here. That's the superior facet because it's on the top of this L4 vertebra. But there is also an inferior facet joint. Actually, this is the superior articular process here. The superior articular process here and here. And what it does is it meets with the inferior articular process here. It's on the bottom of the vertebra, has an inferior articular process. And here's the one of L4. Here's the inferior process of L4. And it is joined with the superior articular process of L5. So this joining of these two processes, the superior and inferior articular process, forms the facet joint. So this is the facet joint. You notice how it's facing outward because it's meeting with the other facet, which is facing the superior facet, which is facing inward. And these two facet surfaces glide together like you can see right here. Look at when this person bends down, the vertebrae open up and separate from each other. And you can see these two facet surfaces gliding against one another. And here's a superior view looking down, and you can see here the facet surface, the superior articular process of the vertebra here. And you can see its orientation, and it's got a really slippery surface here. And it meets with the slippery surface of the vertebra, of the inferior articular process of the vertebra above, and they slide very nicely and smoothly upon one another. Matter of fact, when you bend backwards, you can see how these two articular processes, the superior and inferior, are the inferior and the superior. Try that again. The inferior process of the superior vertebra extends and glides downward on the superior process of the vertebra below. So, whereas this is the superior vertebra, the one above, this is the inferior vertebra, the one above, the below, this is the superior process on the inferior vertebra. And this is the inferior process on the superior vertebra. And they meet and they form a wonderful little synovial joint that allows our spine to move in flexion and extension mostly. And rotation and lateral flexion. Different areas of the spine have different movement characteristics. In between those two processes, you have what is called a joint capsule. A joint capsule. It is surrounding the joint. It is airtight. Tight. It's got a fluid inside there, though, called synovial fluid. And it wraps this joint up, and the fluid is kept nicely in there. Very slippery fluid allows these joints to move very, very gracefully and smoothly. Now, this is the sound that's heard when a chiropractor pops your joints, or when you hear a cracking sound in your back, what you're hearing is the sound of this joint stretching. And this joint here, you can see it's kind of, the capsule is kind of bulging out a little bit. But here's an example of the joint stretching. As it moves away, these fibers will stretch out, the joint capsule will stretch, and when it does, it creates negative pressure. It increases the volume in that area. Let's say you have an area that's this big, and it has some volume, and then you stretch it till it's this big. Well, that volume just got greater, didn't it? Yes. When the volume of that space there becomes greater, the pressure gets smaller. There's greater pressure in this joint. And when that pressure becomes smaller, see, I left one part out. There's fluid inside of these joints. There's actually fluid in there. There's gases dissolved in the synovial fluid. Gases, nitrogen gases, nitrogen. And they're under pressure. So there's pressure on this gas in here inside the fluid. So a gas can actually be dissolved into a fluid, just like in a Coke can. Carbon dioxide is pressurized There's CO2 in here, pressurized gas inside the fluid, inside the Coke. And when you pop that top, that's high pressure in the can. When you pop the top, the pressure decreases. And when the pressure decreases, the gas that's dissolved in the fluid in the Coke begins to come out of the solution. Well, in a similar way, the nitrogen gas, not CO2, well, there might be some CO2 in there. The nitrogen gas, when the joint is stretched, the pressure goes down, and this gas, nitrogen gas, which is dissolved inside the fluid, comes out of the fluid from the decreased pressure. A popping sound is heard, just like a popping sound of a Coke can. And that all happens in this little joint space right here. It has nitrogen gas in it. There is a very strong ligament. So that's the facet joint capsule, by the way. The facet joint capsule right there. But there's a ligament that runs, a very strong ligament that runs up and down the front of your spine. This is the anterior portion of the spine. This is the bumps on the back of your spine right here, and right there. This anterior longitudinal ligament is very, very strong, and it keeps your body, it keeps these vertebrae from flexing or from extending too far back. And when you bend forward, it kind of slackens a little bit. But when you extend back, it keeps your vertebra from pushing too far forward when you extend back. And of course, vertebra L is your vertebra here. Some other things to note is the vertebral foramen, and otherwise known as the vertebral canal. The vertebral canal is this hole right here that the spinal cord travels down and through. Here's a better view of it right here with the spinal cord inside, right down here. The vertebral canal, most commonly known as the vertebral canal, not necessarily the vertebral foramen. The intervertebral foramen, now what does that sound like? What could that be? Well, what does inter mean? It means between. What does foramen mean? It means hole. So it's the hole that is between two vertebrae. And here is the intervertebral foramen. This arch on L4 here combines with the superior arch here on L5, along with the vertebral disc here to the left or to the anterior, and the capsule on the posterior, and it forms a hole. And that hole is for the nerve to exit right here, the spinal nerve looking down. The spinal nerve will exit out of that hole right here. And that nerve will go down to the knee and to the leg and innervate the muscles and the skin and the blood vessels, etc. Obviously, or perhaps not obviously, this is a very peculiar place, because what if this disc, like we described below, decides to burst? What if the nucleus pulposus decides to spill the jelly from the donut, decides to come out, breaks through the annulus fibrosus, and begins to impinge and press on this nerve and take up all the space in the intervertebral foramen. Intervertebral foramen. It's a hole between two vertebrae. What if it starts to press and lay on that nerve like we see down here? We're going to have some problems, right? We're going to have some problems in the skin and the muscles and the blood vessels, the glands and things that go to the leg, where the L4 vertebra goes to, or the L4 nerve. Another ligament to be aware of is the posterior longitudinal ligament. We have here the anterior longitudinal ligament, right? The ALL. Back here we have the PLL, the posterior longitudinal ligament. And you can see it right here. And it does a pretty good job of containing the disc material, the nucleus pulposus inside there, but it's not as thick as the anterior. The anterior is broad and thick right here. Here's the anterior longitudinal ligament. And so the nucleus pulposus can, in fact, sneak out kind of off to the side. So the most common kind of disc herniation is a posterior lateral disc herniation. Sometimes, certainly, it can push straight back like that. But most of the time, it'll squeeze out to the sides because of the protection of the posterior longitudinal ligament. On the top of every vertebra is called a vertebral end plate. It's this structure here, the vertebral end plate. And it protects and keeps, well, it's the top of the vertebra and the bottom of the vertebra here. Sometimes what can happen when a disc, when the spine begins to degenerate, don't forget that water is incompressible. You cannot push water down. Gases you can compress, certainly, but you cannot press down on water. And as I told you, the disc has this center, this nucleus pulposus is filled with water, a protein, carb, water substance called proteoglycans, but it's very watery. And if you try to compress it, certainly it can, squirt out the side like here. Another thing that can happen is it can begin to sort of herniate up down into the vertebral body of the vertebra above and below. And that completes the page 25 of Anatomy Coloring Book, The Vertebral Column. This is Dr. Stephen Harkins. Until next time.